Doc.
Hey, Doc.
Here's the results for your ABG.
Oh, okay. See that? His CO2 is kind of high, so what I would like you to do is I want you to increase his tidal volume to 550, rate to 16, FiO2 to 45, so that we will be able to decrease his PCO2. All right?
But Doc, you know this patient's a COPD patient, right?
Yeah.
Okay, so I don't think increasing his minute ventilation to decrease his CO2 is such a great idea. Since he is a COPD patient, if you look, his pH is normal.
Yeah.
Just indicating us that that's where he lives. So although his PCO2 is 59 and that may be high for a normal patient, a healthy patient, since he's a COPD patient, it's hard for him to get old air out, thus he'll retain CO2.
Yeah, no.
So I think as long as we keep that pH within normal range, we shouldn't mess with the minute ventilation.
Okay.
I think if he's hypercapnic always, then we should just leave it like that as long as his pH stays normal. We do agree with you though on the FiO2 increase.
Yeah, the FiO2, we do agree on you. Bumping it up to 45%, I think we can get his saturations up to 90-ish. Let's say if you look at the hemoglobin dissociation curve, I'm not sure if you're familiar with it, but you know, that correlates PaO2 with SaO2. So by bumping up his PaO2 up to 55, 60 millimeters of mercury, we can get his saturation up to 90 levels. The American Thoracic Society guidelines indicate that a SaO2 of 88% should be really good for a COPD.
Yeah. Or a PaO2 about 55 also
Right,
they
right.
say is a good guideline.
Yeah.
Because like he said, in the curve,
What
it'll
is that?
correlate. So the curve just correlates the PaO2 with the saturation. So it lets you know, like if you have a PaO2 around 55, 60, you should have a saturation around 90%.
Okay.
So I think that should be our goal. So, and also, you know, the oxygen carrying capacity.
Yeah,
So,
what is that?
so just since 99% of the oxygen is carried on the hemoglobin, as long as this patient has normal values for hemoglobin and his saturation is around 90%,
Yeah.
his carrying capacity should be normal. His CO2 should be normal. It shouldn't be a problem for like diffusion or anything like that. So I think our main goal should just be to increase his PaO2 to around 55 to 60.
Okay.
Yeah, afterwards we want to monitor the patient until he reaches that SaO2 of 88%.
Yeah.
And then we want to do an SBT, spontaneous breathing trial, and then begin the weaning process.
Okay.
So yeah, so we'll begin to monitor this patient after we increase the FiO2, and then
Once that saturation hits around 88%, we'll draw another ABG.
Yeah.
We'll bring you the results.
Do that.
And we'll see if you're
When
okay
you see
with
his progression now.
yeah, we'll see if you're okay with initiating SBT and the weaning process. And I think we'll be alright. Since he's a COPD, we're trying to get him off that vent as soon as possible.
you don't want him there too long, so
Okay.
keep that in mind.
Sound good to me.
Alright, Doc. Thank you.
Alright.